And this is my patient, really interesting one. Now this actually is not the treatment day. So this, what you're seeing here at the moment was the first initial appointment the patient came through. As you can see, we've got a lot of swelling, inflammation here.
Yeah.
And this is about 10 days later post-treatment of, I want to say it was optimized. I think it was optimized. The patient was prescribed. Now, this patient had recently gone to Spain on a holiday, and I know we mentioned on one of the previous videos about, you know, public pools, especially abroad, tend to get quite high risk of infection, and this is exactly what had happened. Patient had jumped in the pool, got some water in the ear, and it just, well, as you've seen on the very start of the video, it just completely swollen shut. Patient actually was, explained that he was kind of almost fully deaf in that ear, and as soon as I looked, and I was like, yeah, I can see the problem straight away. It's an ear infection.
Yeah.
And that actually was me like pulling the ear as well. That I was actually
really
pulling
shit
the ear, and it was just nothing at all. So, you know, we can't really do anything when it's at that stage because we just can't get any tools in, can't use a suction, we can't get the manual tools in. So, you know, we have had no other option but to send the patient to a GP or pharmacist. So we've got the Jobson horn in here now, the thick old round Jobson horn.
Cheerio on a stick.
Yeah, you can see it's just, it's quite a
pushing
hard
it back?
Yeah, it's quite a hard piece of wax. So I was going to say I go in with this St. Bart's sock.
My old buddy, the St. Bart's sock.
Rhys's favourite tool.
My favourite tool.
There's a little gap above it, so I'm just going to gently try and nip the tip of the St. Bart's hook in because it's quite a dry plug.
So just put the tip in.
Just nip the tip in.
Just put the tip in.
And we're gonna. There you go. Oh, look, it's quite a long piece as well. You can see that thick layer of skin at the bottom of it as well. But
fair play.
Yeah, but feeling much better. The patient actually, when he came into the clinic to see me 2 days ago, after the treatment, he basically said that I think that was the problem. It was the swelling. He'd used the spray, used the drops. And he said his ear eventually just opened up and cleared up, but obviously we needed to clear that up as well. But yeah, what was it, centimetre and a half.
Half an inch on that one, guys. So this is my patient, guys. This was a lovely pediatric patient of mine that came through. They've been feeling super duper blocked up, and you can see why. We can't see the eardrum at all in here, or maybe a tiny bit in the top left corner. But apart from that, you can't really see anything. So the wax is super deep. It's very mushy, very wet, and I thought, oh, this is going to be a bit of an awkward one to do. Now, sometimes when it's like this, we consider doing some irrigation, but the patient had some irrigation at a different clinic about 12 months ago, and it has actually caused the patient to get an infection in their ear afterwards. So we can see here, we've got this, yes, I didn't think it was going to do that. I thought we were going to be peeling everything, but we've got this really thick, sticky plug that's just come away from the eardrum, and it came away really nicely. So let's get this out. There we go.
Oh, look at that. That's what you like to see.
Yeah. So it's come all the way out here. Let's get this one out as well. There we go. So we can see the eardrum beyond. So that was, do you know what? I was really relieved to see that coming away the way it did. So I'm just going to do a little bit of tidying up. Now, because the patient had such a bad experience at their last care, they were super duper nervous, bless them, about having some bits and pieces done. So what I've done here is I'm going to just be as gentle as I can. I did check in with the patient and with mum as well, make sure everyone was okay with what I was doing. But we're just going to take away some of these last little pieces here. But ear canal looking so much better. And what I've advised now is that we do this about every 12 months just to keep on top of it so it doesn't get to that kind of really sticky blocked up phase that we got there.
Yeah, it's quite tricky when they're nervous as well.
It is.
You don't want to be in there too long.
No.
No. Yeah.
No ruler shot now because everything was so mushy, it all just disappeared up the tube. I know. And this was Taylor's turn to do inches as well, seeing he didn't have to do it. Dodge the bullet. Dodge the bullet, Taylor Green. Yeah. So this is my patient today, guys. Oh, this was an interesting one. Now, this was a lovely gent that came to us. Basically, he's a surfer. What we've got here is basically an infected ear canal. So this is something called swimmer's ear. Now, when you look in here, first of all, it was difficult to say whether it was a wet wax or whether we were looking at a bit of wet skin. But based on the gent's history, he was having some pain. That's now subsided. But you can see that the ear canal here is quite swollen up on this particular side. And when I started suctioning, I started off with the standard size on the tube, but I could only get so far in.
It's too tight.
You just lost my view. So we got here the fine end now, and I can see that this is skin straight away. Now the gent has had a history of swimmer's ear as well. So he had an infection last year and was starting to feel a similar kind of set of symptoms. He did have it cleaned out with some suction last year, and that did help the symptoms. But he was saying he's feeling really, really blocked up at the moment. Now, it's difficult to see yet because we're right on the outside edge of the canal. But what we've got here is quite a thick skin plug. So all the skin's come away from the sides of the canal wall. So if you don't know what swimmer's ear is basically when you get an infection from water, getting water inside your ears, which can happen to some patients. And that's exactly what happens here. It's more common, if you're sort of wild water swimming or, if you go on holiday, some of the foreign pools and things like that, some people are more prone to getting infections. But here's that skin plug.
We tend to see it a lot with public pools than we do with them, especially if they haven't been
maintained.
Maintained properly, cleaned properly.
Definitely. And that's what we've got now, is this big thick plug. Now I was using the fine end, but I couldn't quite get the grip I needed, so I've switched up to the standard size only. You saw a big chunk of that skin getting sucked inside the tube here.
I've actually got a similar one coming up soon. With the sort of before and after treatment.
That's right.
Well. So that'll be an interesting one.
Now with this one, we're clearing out basically all the debris, and the reason we've done this, or this way around before we do treatment, is because this is such a big old skin plug. If we put the treatment in, it just wouldn't make a difference because it would just sit on top of that dead skin rather than get into the fresher skin underneath. Yeah, look how thick that was. The patient was really intrigued by that as well. They wanted to sort of touch it and pull it apart and see what was going on with it. But all that's come away. So it is going to look...
Break it apart, get the microscope out.
Pull it away. So we can see the ear canals now. Look how red and irritated those canals are. So I've given some advice of things to use until they can get some treatment. So I've said, use a bit of ear calm in here. That's not going to get rid of the infection, but it'll certainly slow the progress of the bacteria in here. But the eardrum, it looks pretty puffy and aggravated. You can see it beyond, but hearing a lot better, which is what they wanted to do. So yeah, advice, giving them a bit of ear calm, told them to go see their GP or speak to an online pharmacist as well. If it's difficult to get into the GP, you can do a consultation with an online pharmacist, and you can get a spray usually called Automize, which is what they'll use for this. But you can see it's a very kind of, almost like a creamy kind of discharge in here.
Always itchy as well. Usually, a lot of patients report a lot of itching sometimes with this type of ear infection. Not normally like painful or uncomfortable, but itchy. Well,
that's looking a heck of a lot better. Now we wouldn't wash that out. You wouldn't use irrigation on that because it's just going to make things worse in there. So we've got quarter of an inch. It's massive, huge. Quarter of an inch, I want.
Yeah, half a centimetre.
Half a centimetre. Well guys, thanks very much for watching the video again today. If you do enjoy the videos, you can always like, heart, share, follow and subscribe for me. And if you thoroughly enjoy the videos, you can always consider becoming members of the channel. That way then you get to see even more videos as well. But as always guys, take care of yourselves.
Take care of your ears.
Take care of one another. The mental block that I can remember the last bit. Myself and the lovely Miss Taylor Green. I'll see you again real soon. Bye everybody.
Bye.